Okay, thank you very much. I'm just going to start the presentation with thanking all my graduate students for all the work they've done. Without them, this presentation wouldn't be possible. We're just the lucky ones that get to present all the data over the years of what we do. And Diana, I have the best graduate students, not you. Sorry. Okay, so I'm going to talk about intense exercise. Is it a friend or is it a foe to our central nervous system? I've been kind of focused in this area for the past 8 years or so in our research lab. And unlike Diana, we don't have a very nice lab title, SPINE. We have H&L, which stands for Human Neurophysiology Lab. So it's not so fancy. So what is intense exercise? Well, it kind of depends on the exercise, but essentially it's where you're working near maximally or maximally. I just want to say that most of this, not most, all this work is based on people who have no injury. So apparently healthy individuals. That's most of this work I'm going to talk about. Now, how do we do that in our lab? Well, we can sit in this torturous looking device and do isometric contractions, as Greg just talked about, where you're just pushing against a table. But in this case, we're lifting up against a lever here, or we have our foot, which could be locked in place. And it's kind of uncomfortable at times. You can't move. You're just stuck in this chair, and we can do stimulation techniques to the individual. And it's anyway, it can't be. It's not so fun at times. Or we can sit in another torturous-looking device, and here we do muscle contractions as if you're in a weight room, but we can actually control the speed at which you do your muscle contraction, and we can control the amount of force that you can apply. We can sit on a bike and cycle for as fast as possible or for as long as possible. We can get into a squat rack and do a pile of squats. As you can see, all these people look tired and not so happy about what they've just done. We've created a device where we can have somebody sitting down and cycling with their upper body at given resistances and for different durations. We now have a treadmill, so we can put somebody on the treadmill to run at different intensities. So, i.e., we change the speed or we change the incline. The idea in the lab is when we do that intense exercise, we use measurements to try to figure out what's happening from the brain to the spinal cord to the muscle. How is that changing? How are those inputs and outputs changing when we do the intense exercise? Essentially, the idea is that we have a brain which is kind of driving or sending information down to the spinal cord, which is then driving the muscle. So in all cases, we're creating some sort of force, right? No matter what exercise we're doing, we're creating forces, okay? In order to do that, our brain, we're telling our muscle to move, so we're voluntarily activating it. We're driving it from the brain, so it's voluntary, okay? And when you look at the muscle itself, we have to think about, how are we getting that output from the brain and spinal cord to the muscle, and what's happening within the muscle. So we have peripheral transmission and contractile properties. Then at the spinal cord, we have synaptic efficacy, we have kind of facilitation, dysfacilitation, as Greg was talking about, excitation, inhibition, kind of. We have feedback coming from the muscles, which Diana has talked about quite a bit already. We talked, and motor neuron excitability, and plus we have a pile of other neurons that's in that spinal cord. And then at the brain level, we're really interested in the cortical spinal neuron. So how can we excite that, make it more excitable, maybe inhibit it to get the output down to the spinal cord to that muscle? And when you look at it, when we do a lot of intense exercise, you take the brain and the spinal cord together, and when you have changes that occur at those levels, we call that central fatigue, or mechanisms behind central fatigue. And at the muscle, we call that peripheral fatigue. When we get into the lab, I show this figure again. This individual, we essentially stimulate at the brain, we stimulate at the back of the neck, we stimulate at the nerve. So here we just around the shoulder area at the clavicle. Okay, we can stimulate the muscle by itself. You can't see any of it's hidden under the shirt here. We have electromyography, so we record activity from whatever muscle we're interested in. Okay, you can't see down, we're right here, there's a force transducer. So when that person's pulling up, We can collect forces. Okay, we can do that for whatever limb that we're interested in. When we do cycling, we can look at power generation. How much power can someone produce? And in this situation, on the bottom here, we have a Wingate test. Essentially, it's a defined time. It's 30 seconds long. It could be 10 seconds long, 25, but it's a short duration. But you're moving as fast as possibly as you can against a given resistance. Okay, and what we find over time, you can see we can just calculate all the power, and that changes over time. We're also interested in using ultrasound to measure muscle and subcutaneous fat thickness. We can use skin fold calipers to help measure that as well, and we can take circumferences of whatever given limb. And then we're also very interested in pain. So we have part of that, a little bit different, is rate of perceived exertion. I'll come back to that in a minute. But what exertion do we have? So we measure that. The pain threshold, we do that through ergometry. So we essentially just press in on a given part of your muscle. And from the point where you say, okay, this doesn't feel like pressure anymore, it feels like pain. Okay, so we have the actual force that's behind that. It's on this, you can't see it right here, but it's in a little dial, so we can measure that. Or then we also have the visual analog scale for pain. So we rate our pain from a 0 to a 10. So what happens as a result of intense exercise? Well, we get really tired. The nervous system gets very tired. You can see here the power output, if we're doing a cycling task or multiple cycling tasks, power output just drops off very, very rapidly and continues to drop off as you keep doing more and more of it. And then we ask the individual maybe to get off that bike, and we'll ask them to do an isometric contraction. Okay? And you see over time, when they're really fresh, they produce a lot of force. And as you get more and more tired from doing the cycling, their force outputs go down and down. And then we use different stimulation techniques to try to figure out, well, what's going on in the central nervous system versus the peripheral nervous system. And as we start to quantify neuromuscular fatigue, as you see the fatigue's getting more and more, we see that there's both peripheral and central aspects to that. Okay? And for some reason, central fatigue kind of comes in a little later. Peripheral fatigue starts right away. Central fatigue comes in a little later. If we just did MVC forces, maximum voluntary contraction, so we sat at a table and I pulled up on the table as hard as I can for several times, you start to see MVC force going down over time, and that's partly due to central and peripheral fatigue. We also get a lot of pain. We get delayed onset muscle soreness after we do a novel exercise or something new, and it doesn't even have to be new, it can be old, but we do exercise. There's a period from 24 to 72 hours later, we get a lot of muscle soreness. And it's a dull, aching pain, and it has a lot of tenderness. I'm sure many of you have probably gotten this before. And typically that soreness peaks around 48 hours and can even last up to 96 hours. So several days later, I've even had it 10 and 11 days later. The other piece, we talk to rate that pain, we look at the perceived pain. So again, from the numerical scale from 0 to 10, go back to the cycling example. When we sprint repeatedly, we do 10 of them, people start to perceive it as being more and more painful as we go from sprint to sprint to sprint. And the RPE starts to go up as well. So the rating of perceived exertion starts to go up. And there's a correlation between perceived exertion and pain. As perceived exertion gets higher and higher, people start to perceive it maybe as being more and more painful. And if you look at the idea of pain and doing a lot of squats, for instance, right after we do the squat, we have you don't have to worry about this per se, but we have big changes to the neuromuscular system. We can't perform the same way. It drops off big time. And you can see here that after doing that 10 by 10 weight training set, we have no exercise, we have no pain before the exercise, and all of a sudden our perceived pain jumps up, and it's much higher, up to 72 hours later. And even at 48 and 72 hours later, some of these factors here are still reduced. We're still tired and we're still in a lot of pain from that exercise routine that we did. And in fact, if you really want to get into delayed onset muscle soreness, there are a couple major models proposed. One is the ischemic model, okay, so low blood flow, and the other one is a mechanical trauma model where you're kind of ripping apart muscle fibers, and when that happens, you activate sensory receptors that then send the signal back up to the brain, as Diane and I were talking about earlier in her presentation. So intense exercise has been my flow, okay, for sure. When I first got back here and started my job, I trained a little too hard and I hospitalized myself for 6 days. It wasn't good, but I had extreme fatigue and I had pain, a lot of pain, okay? And you don't have to go to that extreme, of course, nobody has to, but if we exercise, we get tired and we do get pain, okay? So it can be a foe. But it's also been my friend. I've been exercising. Greg talked about what shaped and polished him. He talked about his powerlifting. I've been partaking of physical activity since I can remember, and I started resistance training at the age of around 18. I continue to do it to this day. And when we have increased activity, it alters and enhances our central nervous system and muscle. I just show this here. Resistance training enhances force production. And we have two lines here. We have what we call chronically resistance trained individuals, people who've been resistance training for 1 year or more. And we have people who have not done resistance training, they're recreationally active. And you see here at the end, the non-resistance trained individuals, when they're at 100% of the amount of force they can produce, okay, they get around 25 kilograms. People who've been training for 1 year, they're only at 60. When the non-trained person is at 100%, the trained person is only at around 68% of their force production. That's a huge difference. Right? That's a big difference. A recent paper that's been submitted and hopefully be accepted soon from Evan Lockyer, a PhD student under Kevin Power. He just did 2 weeks of sprint interval training. That's on the bottom here, the SIT, that stands for sprint interval training. And he showed that that training enhances someone's power and also enhances so their power and the amount of time they can withstand fatigue for. Okay? And you see in the title, or you notice in the title, it enhances spinal and reduces supraspinal excitability to the biceps brachii. Okay, so it's altering, that training for 2 weeks has altered the nervous system. We published a paper not too long ago looking at this idea of what is resistance training doing. I'm going back and forth between different types of exercise modalities. I'm gone from sprint training to resistance training, but in the end, they're all intense training. And you look at the untrained individual, their muscle here is a little bit smaller, and we're saying that there's some circuitry going on that's going from the brain to the muscle that becomes active when they activate their muscle. When an individual starts to train acutely, you can see now that compared to the person who don't train, their max torque goes up some, okay, compared to the person before. And you can see now we've colored a little bit of what's happening here in the circuitry in the spinal cord and in the brain, and it's a little darker because there's some alterations that have taken place along that circuitry, which allows us to produce more force. And we see that there's a huge neural component to that. But when we get into chronic resistance training, now with the chronic resistance, we have time that the muscle grows. So the muscle is quite a bit bigger, okay? And you can see that we produce even more torque compared to the acute resistance trained and non-trained individual. But there's also still another neural component to that. And you can see the coloring in here is even a little darker compared to the acute resistance training individual. That's not working now. That's not working now. That's not working. Okay, here we are. Good. This was a figure that came out, very famous figure back in 1988, sorry, by Digby Sale, and it's in many exercise physiology books. And what Digby was a strength training coach, and he turned PhD, and he made this figure a long time ago, and he said that typically when we start to resistance train, and you see here in the top line of strength goes up very quickly. But a lot of that increase in strength is due to quick neural adaptations. personally, I think a lot of neural adaptation is us learning how to turn on the muscles that are required to produce that force and turn off the ones that are going against it, they're opposing it. Quick neural adaptations. Okay? And then you see very little from the muscle. And typically when we say short-term resistance training, we're talking 8 to 12 weeks. But if you get into the more chronic training, right, you see overall muscle gets bigger, and there's still some changes to the neural, and we get more increases in strength. And what we've been saying lately is that once we get to this plateau here, I don't think strength really plateaus. It just changes, probably because we get older, changes in life, all sorts of things. But we change the way in which we train, we can start altering the nervous system and maybe the muscle, and two of them being altered together, which can alter how we increase our strength over time. So, intense exercise, friend or foe? No or acute exercise? Smaller muscle, the circuitry is not that well developed or used to the idea of what training is. Okay, we get very tired and we get a lot of pain. But then, as a result of that, we alter the nervous system. We get bigger muscle. We get increased fatigue tolerance. And we get reduction in pain. Now, I said to you, if you exercise a lot, you get DOMS, and it's painful. But over time, we have something called a repeated out effect. And all that means is that as we exercise more and more, we start to tolerate the pain more. In fact, we don't feel DOMS as much anymore. So that's a good thing. I guess in the end, I picked this word triune. It took me an hour to figure out what a tri word. I was trying to say triological, but that doesn't even exist because I want to put biology and try things to it. But when I want to understand intense exercise, I really, when we look at it, there's three pieces to it. We get tired all the time, okay? We got to do the chronic exercise itself, and we do have a lot of pain. So how do the three of those come together to help define what we do in the neuromuscular system in relation to intense exercise? It's kind of what I really like doing in the lab, and will continue to do so for the next few years. Thank you very much.